Hello, everyone. Today we are here with Dr. Neha Kwatra. She's a dear friend that accepted to participate in this interview. Dr. Neha did her radiology residency in her medical school in India. Then she did the alternate pathway here in the United States, transitioning her career in radiology here. She did pediatric radiology as a fellowship, and then she also did nuclear medicine. Many things happened in this way, and eventually she became the program director at Boston Children's Hospital for pediatric radiology, and now she currently serves as a associate program director. Dr. Neha, thank you so much for being here. It will be wonderful to hear more about your story, your insight, and just more about you in general.
Sure. Thank you, Jade, and it's very nice to be here. I'm very glad to be here, and thank you for inviting me. Is there anything in particular that you want to know from me?
Yeah.
How far back do you want me to go?
Dr. Neha, I want to know how was it for you in India when you did your medical training, your decision to become a radiologist, and when did you start thinking that you wanted to bring your career to the United States?
Sure. So I did my medical school in the city of Mumbai. That's where I grew up. So during medical school, I mean, we were not exposed to much of radiology during medical school. I think as even now most people are not. I did do it as an elective rotation, and I don't know if I knew much about radiology. I knew what I did not want to do at the time, which was surgery and gynecology and other things. And so it's just I didn't think that I had like great procedural skills. So it was sort of maybe a kind of like the specialty of exclusion. That's how I came to it. It seemed nice, people looking at scans and in a calm environment and like going about their job. Also was mentally stimulating. I mean, they are making decisions, and so it. I think that part of it, that it was mentally stimulating in a relatively more calm environment, and there was not as much procedural skills that were needed. That probably made me more attracted to it. So nothing great here, but that's how I came to radiology.
Many of us, I think.
I think in most people, as I said, don't have much exposure to it, so it's hard to know what the real world radiology is like in medical school. At least that was the case when I was doing medical school. It's been like almost, I finished, so it's been, I finished medical school 2000, so it's been about 20 plus years. So it's been a while. And so that's how I wanted to get into radiology. Radiology, like in the States, in India too, is a very competitive specialty. So you had to take entrance exams. You wrote some entrance exams, got into radiology at the institution of my choice, which was in north of India. And it was all I expected and more. I mean, I really enjoyed my radiology residency, and it was a great experience. In our institution, there were many more senior residents who, after they finished their training, they already, there was kind of like a pipeline almost for like many senior residents would go to Canada first because you don't obviously require any exams for that. So so I had some experience or some information from them, like ways to do more training. So I mean, the basic reason for me to even think of going outside was there were very limited specialty trainings available in radiology at the time. One was interventional radiology, which I already told you was not was not going to be what I wanted to do, and the second was neuroradiology, which was a 3-year fellowship. And I liked neuro, but it was not something that I thought I wanted to like definitely do. So any other subspecialty that I would want to do, I would have to move out of the country. So that was the main reason too, and because I had more senior residents who had. Many of them had gone through Canada into the U.S. There were some like more senior people who were already in the U.S. So I had some sense of what people do or how they do. And I did know about the alternate pathway in radiology at the time just through them.
I see.
And my husband, who was, we were dating at the time. We were in medical school together. He's a pediatrician. So he and I, at the time, then decided that we both of us want to go. And like towards the end of our residency, we decided to take the steps and then take the plunge. So I did apply to Canadian programs too, I think, but did not end up going there. I mean, I was more set on coming to the U.S. directly. So that's how it came about.
I see.
Yeah.
That's awesome. And when you decided to do that, the pathway, this alternate pathway, did it exist for a long time? Was it something new? How was it?
Yeah, I mean, as far as I know, or I knew at the time, it had existed for a little while. I mean, at the time when I was applying or I was taking my steps, I mean, there were always rumors that this pathway will go away soon. So maybe it's better to apply for radiology residency again. But it's been 20 years since it's still here. So I'm here. I think it's here to stay. But I did know about the pathway, and around that time, it had existed for a little bit.
And this was 2000 and what you said?
2007, I think 2000.
Around 2000.
I think 2007-ish.
2007. Yeah, so I would just make one comment about that. 2007, and Dr. Neha is saying that at the time they were saying this is the last year, it's going to end.
Yeah, no, it was really. I mean, at the time, and I've heard that multiple times over the last 20 years that it's going away. But I think with the shortage of radiologists that we have, especially in pediatrics, but in most radiology specialties, I don't see it going anywhere anytime soon.
Well, that's reassuring because everyone that is beginning to think about it's always concerned that they will invest and maybe like investing in doing the steps and everything and end up not getting a position because it will be terminated, right? But it's good that we'd never know. But what we've seen, 30 years happening that, so
yeah, and we have a shortage, so I think it if anything, I've seen it getting easier with time to meaning they have relaxed some restrictions. It used to be that you have to do all the 4 years in one institution. Now you can do it at two different institutions. You can also complete the pathway in like 7 or 8 years instead of like the 4 years. So as far as I can see, it's they're trying to make it easier, not harder.
Yeah, I agree with you. But Dr. Neha, then going back to what you were saying, then you decided to come here. You did the steps. Was it hard at the time to take the steps? Do you remember?
It was okay. I mean, I felt like it would have been harder for me to do the steps right after medical school because I'd undergone radiology residency. I think you get. I mean, radiology obviously. I mean, it's a clinical specialty that touches all different types of subspecialties. So step 2 is kind of easier as a radiologist than it was as a medical student. But even step 1, I mean, there's anatomy, there's physiology, there's different things in radiology. So I would say I think it was easier for me. Maybe I also didn't have to prepare for that long to take the steps because the residency kind of instills in you the sort of clinical thinking that you need to be able to do well on those tests.
That's great. And then after that, so you started here in the U.S. first, right? What was your path after you came to the United States?
So my husband, he matched into a pediatric residency at DC Children's, and so I was visiting him then, and he asked me if you want to like just observe in the pediatric radiology department here. I said, yeah, sure. So I asked the program director there, like, is there a position, is there like an observational rotation that I can do? And she was like, we have a fellowship spot. Do you want to interview for that? Like, okay, I was not planning for that. But yeah, so at the time, I mean, I'd mostly come to the States to take my CS. We had this clinical skills examination at the time. It's gone now, it's great. But so I'd come to do that and step 3. So it was around this time I was looking for observational rotation to kind of improve my CV and other things. And so I interviewed at Children's National in DC, and I got the job. And I was there for 4 years as a pediatric radiology fellow.
That's amazing.
So yeah, I didn't have to I don't have a story of like interviewing multiple places.
That's good.
My husband does. He had to go through the match. He had completed his pediatric residency in India, and then he had to repeat his residency, obviously. So he had to go through the
whole
match
process,
and then the 15, 20 interviews. And it's like, why don't you find a place and then I'll just interview there. That's what we've been doing since.
That's awesome. And good that the radiology training was valued, because then you can come and just work on what you want to learn to be your subspecialty. I think that's amazing that you had the chance to really invest in pediatric radiology. That's what made you awesome.
Yeah, I mean, it was good. I think it was. I strongly believe sometimes you just need longer training. And in my mind, 1 year of pediatric radiology fellowship is great. But I mean, if you can do at least 2 years, I would say it's wonderful. So I do think it makes a difference in then there's this learning curve is less steep when you are attending. So for me, it was something that I had to do. But I think doing training for longer should not be deterrent for anyone.
Yeah, there are benefits to it, from sure.
Yeah, I think they're mostly benefits. I mean, losing a year of your life training, probably not that bad.
And about that, when you came, so you started fellowship as a pediatric radiologist. Were you kind of afraid when you started? What did you feel? Because you didn't have pediatric radiology training before, right?
I mean, I had in my residency, I had 3 months of pediatric radiology like every other place. One of our residency program was one of the better programs for pediatrics in some ways. So, but of course, there were differences. Like there's differences in pathologies, differences in things, the way things are done. I'd never seen a modified barium swallow being done. As like I did not quite get it why it's done. So and the different types of lines, and it's a different world, obviously. At the time, I had not used PACS, and we did not have a dictation system. We used to write, and then someone would type the report for us. So it seems ancient, but it was 20 years ago, I guess. So, so those parts were different. But I mean, it's also a little bit blurry right now since it's old news. And but I think it was they ensured that I did not was on call like within the first 1 or 2 months. I mean, so that I get time to acclimatize to the place. But after that initial changes that you experience, I mean, you have to learn to adapt. It was okay. But I think so you'll have to obviously learn and adopt and be ready to do that, put in the work that's needed. If you do that, I think the environment, especially in pediatric, anything, I think is very supportive. People are nice around you. They want you to succeed. So they help, and you learn and grow.
That's it. I completely agree. Like when I started at Boston Children's, I was so afraid because it was my first position as a research fellow. But that's something that I noticed immediately, like the environment, the people in pediatric radiology, they are unique. And I remember asking that to Sarah and to May. Is it like everyone in radiology is like that, or is it just peds? And they said it's peds.
Yeah. I mean, I have done a year of nuclear medicine, so I can definitely attest to it being peds.
Nice. And that's something that people are always concerned, and I wanted to know your opinion about that. Oftentimes, when someone comes here for a pediatric radiology fellowship or some other fellowship, they still didn't have an intensive training on that subspecialty. They saw something during their residency, of course, like had some months of it, but they sometimes had been a long time doing something else, but they are considering doing a pediatric radiology fellowship. How do you think it is for these people, on your perspective as someone that is looking from outside too? Do you think, is it possible for someone that didn't do a pediatric radiology training to start a pediatric radiology fellowship?
Like no background training at all, or like some training, but not for a gap?
Yes, just didn't do a fellowship in pediatrics before.
Sure. Right? Yeah, no, I mean, that's what you're here for. I mean, you're here to do the fellowship, so no one's expecting you to be like fellowship trained. I mean, you're already a radiologist, and you may have had a gap year of 1 or 2 because you were maybe trying to improve your research portfolio or something before the fellowship. So, I mean, I think you may have to put in extra work at like when you just start out. I mean, I think what can help is looking maybe if you know already that you're going to a program, you can go and do an observational rotation there for a month. Actually, that helped me too. I think I forgot to mention that. So I did do the observational rotation there, but it was after I got the fellowship spot. So,
I see.
So I was able to go through all the different divisions before I started my fellowship. So I think that was helpful to me to see how things are different, and that way you can also like. Most people won't have access to the systems there, but you can read up about it, like ask people what to read. In pediatrics specifically, there were like Cleveland Clinic modules. Those are like online free modules for everyone to read. So I think if you can prepare, there are ways to prepare yourself to have the transition be easier. But if you have like a good solid foundation, ultimately you'll succeed. I mean, it's just prepare, work hard, and respond to feedback. I think if you do all those three, there's no way that you're not going to succeed. So,
thank you. That's reassuring. And in your experience with their children already, seeing fellows coming from abroad, what do you perceive as the main challenges? Maybe you felt them, maybe you didn't when you were the one transitioning. But what do you perceive as the biggest challenges for those coming from abroad, and how do you think they can improve that or get ahead of that?
Yeah, I mean, I think same type of things, mostly like to get ahead of. So I guess let's start with the challenges. So one challenge I think most international graduates face in pediatric radiology specifically is fluoroscopy. Fluoroscopy is a very pediatric, it's obviously it's used in adult practice, but not as much. And in pediatrics, you kind of have to do it.
Yeah.
So, and it's done differently in different places, different countries, different types of imaging. So I find that's one area that people have a steeper learning curve. And so if they have had like once they have one or two rotations, they're fine with that. It's not rocket science, but that's where they're. So that area I find is a little bit challenging. I would also say that's challenging not just for international graduates. That's challenging for U.S. graduates too. It's just that you don't do that much of that in residency. So in pediatrics, that's the main challenge. How you can prepare for it. I don't know if you can prepare for doing fluoro well. That happens as you're on that rotation, but you can definitely read. And if you have an opportunity to do a month-long or even 2-week-long rotation before you start fellowship, like looking at how things are run, I think that could be pretty valuable too. And reading is always wonderful. If you know something, you're able to find things quicker. Like if you don't know what you're looking for, sometimes it's harder. So I would say read, try to get some observational time in. I think, and then people will tell you what to do.
Yeah, maybe also not overstressing also helps.
Yes, I mean, I think it's going to be a supportive environment. You just need to respond to what people are telling you, and then
yes,
people can only tell you what to do, but you have to put in the work to do
yes.
that. As long as you're willing to do that, it's fine. So I think pediatric is hard for anyone, be it an international graduate or U.S. graduate. With international graduates, obviously you're adjusting to the city, you're adjusting to maybe new type of PACS, new EMR, you may not have been exposed to it, new dictation system. So all of that compounds the problem a little bit. But most people, we do have a lot of international graduates in our program. Most people get over that hump in the first 1 or 2 months.
Oh, that's great to know. Okay, yeah, 1 to 2 months. That's really reassuring.
Yeah, and I mean, different people have different flavors, but yeah, I mean, it's different your background, but if you can work as suggested, I think you'll be fine.
Yeah. And it's great here. Not every country is like that. That we here in the medical system, everyone gives feedback. I find it very good. Like there are structured feedback, like report, like you give an evaluation and you get the feedback, but also every day, right? So that's good. Neha, could you tell me who would be a good candidate to try to do this pathway that you did, the alternate pathway?
I guess anyone who's motivated and has a radiology residency. Yeah, I mean, I think you just need, yeah, I would say those are the two things. You obviously need to have a radiology residency. And depends on what your goals are for the future. Like, obviously, if you're trying to develop a academic career in the U.S., you definitely have to do it, and there's no way around it. If you're planning to do just more learning and then go back and apply those to the country that you came from, I mean, then obviously you don't need to do the alternate pathway. It's. I also would not say that you have to be invested in an academic career. I mean, it could be a private practice, but obviously, if you are staying in the U.S. for the long term, that's when I would do it. Otherwise, I think it's a very long time.
To then come back, right?
Then come back to your country. I mean, 1 or 2 years for sure to learn something new that you want to bring back. I think great. I don't know if there are any advantages to try to do it if you are sure that you're going to go back. I would say that most people don't know when they first come in whether they want to go back or not. So if you are in that category, maybe you want to try and get the 4 years done so that you're not second guessing yourself later.
Yes. No, I completely agree.
But you have to be motivated, obviously. This actually is a nice time to be doing the pathway because there are shortages, I mean, especially in pediatrics, but in other specialties too. So people are more open to having international graduates. I mean, there's obviously visa issues that's separate from it right now, but generally people do need international radiologists at this time as fellows to be able to fill their spots. In pediatrics, for example, like we had, for the last few years, the number of U.S. graduates applying to us has decreased substantially. So we are in a crisis mode as a specialty. We now have a pathway for U.S. residents to do pediatrics within their residency. So yeah, as long as you're motivated, I think scores are helpful. Having nice scores are helpful, but probably not as important as you would need if you were trying to do a radiology residency. So yeah, I think some thoughts. Be more like if you're motivated, want to stay in the country, and have done a residency before.
And do you think publications are very important for you to be able to apply?
For fellowship, for the alternate pathway, I mean, they're helpful, I think, but I don't think that those are those are a deal breaker. Having some kind of U.S. experience, maybe I mean, the way those can help is like if you have worked in a U.S. system as a researcher or as just doing some observation, I think that makes maybe you'll find the transition easier. So it can help in that way. I mean, not so much for how many publications you had, but just so having some kind of U.S. experience is maybe helpful so that a program director knows that you may adjust better. But neither of those are like deal breakers. As I said, scores don't matter, but if you have good scores, I think most people would still prefer that. Because for international graduates, it's harder from a program director's perspective to know like each and every program they're coming from through the world. It's hard to gauge the quality of the program. So I think the way you have written your application is obviously important. If you can get U.S. recommendation letters, that would be helpful. If you have some kind of U.S. experience, especially like a researcher or if not, at least as an observer, those would be helpful. And then the scores are sort of one more objective way that at least I look at to know. I mean, that's not a make or break thing, but I think it helps to have a good score even with fellowships or with residency. It's a must.
Okay,
you may know better.
Oh, yes, it is. And Neha, another thing that people are often concerned is about their accent. If having an accent is going to be a problem for them, because sometimes it's hard to lose an accent, right?
Yeah, I mean, I don't think anyone can lose an accent. You just gain accents. So it's as long as you're I mean, everyone has an accent of some sort, like even within the US states, there are different types of accents. So as long as you're understandable to people, I've not seen that to be a barrier with anyone. You just have to, maybe you have to talk clearly. But yeah, I mean, I've not had any issues or, I mean, I have an accent, you have an accent, but as long as you can explain yourself to someone, most people would not. I mean, I don't think that that's even an issue for the most part. And at least the environments that I work within are pretty diverse, and they're used to accents. So it has worked fine in the environment that I work in. Maybe it's different at other places, but I think it's more important to be able to express and explain yourself. Accents don't matter as much.
Yeah. I remember when I got here, I was so concerned also because I could speak English, but I was still learning a few things, and the accent concerned me. But eventually I noticed that everyone had an accent, so I was like, okay, that calms me.
Yeah, I mean, I would not worry about that. That should be, that can be like way, it's not important.
And quickly, I believe that even when someone is still having some trouble communicating in the beginning, of course, we should work on that. But once you are here and performing your duties every day in English, your fluency increases a lot in a short amount of time.
It does, yeah, for sure. I mean, it's, yeah, that happens. I mean, you're working here, you're also living here. So I think all your interactions, most of them are going to be in English outside of home. So obviously that's helpful as well. Yeah.
Thank you, Neha. Okay, so I have one question. One person, she said that she did her general radiology residency, right, diagnostic residency, and she's been working for a few years as a breast imager. Okay, but she really likes pediatric radiology too, but she never had a formal training on that. Would she be someone that, with hard work and like commitment, would be someone acceptable to try pediatric radiology if she's considering to change careers to that?
So someone outside of the country,
Yes,
and practicing as a breast radiologist for a little while. I guess depends on how long it has been. I would say that transitions, if it's been like 10, 15 years, I think people will question, why do you want to do pediatric radiology? But it kind of depends on the overall application, I would say. I mean, that alone may not be a reason to not take someone, but you may have to make a stronger case for why do you want to do this. And it's also, and if you then have like a strong application on other fronts, like if, for example, if the scores are good, if you have good recommendations, so that will help. But yes, I mean, I think that's true for not any like international graduate. That would be true for anyone trying to make a career change. People do have questions. As long as you are able to explain them and the other parts of the application look great, I think it can, it should be able to be worked out. And especially in pediatric radiology, as I said, there is a shortage of the workforce. So there may be increased chances. As long as they are sure that they really want it, it should come across as something that they genuinely want to do. I think that would be helpful.
Okay, thank you, Neha. If you could choose only one soft skill, a soft skill and a hard skill that is fundamental for a good fellow in pediatric radiology, what would you, or in pediatric radiology as a career?
Sure.
Which are the skills?
Soft skill, I think very important soft skill would be communication. In pediatric radio, anywhere it's helpful. I mean, I always say to my fellows, you can never over communicate. So you have to talk to the teams. You have to talk to. In pediatrics, it becomes more important. I think everyone is a little bit more concerned when a child is involved. So as long as you're communicating your thought process to the parents, the kid if they're old enough, and the radiology team, your team members, your supervisor, like it's I think that's a very important skill to have. People cannot read your mind, and you should not expect that, obviously. So I also think if you don't communicate well, people fill in the blanks with not always pleasant thoughts. So it's I think that's a very important skill, especially, for example, if you're doing a procedure or you're doing fluoroscopy in pediatrics. That can be a very challenging thing to do. And if you're explaining what you're doing to the parents who don't know what's going on, to your team members so that you're all on the same page, and similarly communicating the findings that are important in your report to your clinician friends. So yeah, I would say that's the most important soft skill, communication. Pediatric radiology in particular, but generally in life. And hard skill, I mean, having a good radiology eye, like you, I mean, that's what you learn. So if you're able to pick findings, and as I said before, to be able to pick findings, you need to have a sound knowledge base. That's when you're able to pick findings. So having a strong knowledge base and then being able to apply that, which is like what radiology is. I mean, and so yeah, and integrating those findings, all of it together. But it starts with this like strong knowledge of things.
Okay, thank you. And as you were talking, I remembered other things that I wanted to ask you. I'm sorry.
Sure, yeah.
So what happened in your career? Like, in which moment did you decide that you wanted to participate more in graduate medical education, like to become a program director? And then, like, how was that experience too?
Sure. I mean, most things in my life have been accidental, I think. I've not thought as much. I mean, I've sort of like accepted the opportunities that came my way. So I was not wanting to become a program director. It happened that the program director before me stepped down, and they changed institutions. So we needed someone. I was asked, and I said yes. I think it was as simple as that. I was not. I don't consider myself an educator. I mean, maybe I was more of an administrator. I mean, I don't know. I mean, I like working with fellows. I've always have a rapport with them, but it was not that I was. This was not something that I was thinking that I wanted to do. There was an opportunity which I thought would be good for me to like just learn and grow with it, know what it is and how it feels like. Yeah, it was like nothing dramatic happened. This was not my dream come true. It was something that was offered to me, and I thought of it as a good stepping stone to do other things. And because I also enjoyed working with fellows, it seemed like a good fit. So I did that for about 4.5 years, and I'm transitioning out of it to try and do different things.
The path is still.
Yeah, I mean, I was clear that I will not want to do this for 10, 15, 20 years. I mean, there are people who can do that. For me, it was like almost like a 5-year plan, and this is it's going according to the plan right now.
And Neha, when you decided to come here, did you know that all of these things would happen? And looking in retrospect, are you happy with the journey that you had so far?
Yeah, I'm happy with the journey that I've had so far. And no, I did not know that any of these things will happen. I mean, for example, I did not know that I would get into a pediatric radiology program that I wanted to. During the pediatric radiology fellowship, I met pediatric radiologist who was also like a pioneer in pediatric nuclear medicine. So nuclear medicine happened to me then. I did not have much experience with nuclear medicine in my residency. It was a total different specialty in India. So in those 4 years in DC, about a year I spent in nuclear medicine, mostly peds, but some adult nuclear medicine too. No, I had not planned that would happen to me. And then but I liked it so much. Then I decided that I wanted formal training and formal certification in it. So I came to Boston, and I did 1 year of nuclear medicine training there. So, I mean, by the time I planned to do that 1 more year, but I did not start with the plan. And for a long time, like been at Boston Children's for about 12 years now. And I do a mix of pediatric radiology and nuclear medicine. So I'm basically was trained 3 years in pediatric radiology, 2 years in nuclear medicine, and that's how. And I spend, I think, now more time in pediatric nuclear medicine. But I had not planned that at all. Also now going to school, doing like a master's in public health, which an opportunity that that came my way again. I was not thinking to do that. So I would say just be open to what comes in your life. It may not be even possible for you to think what you can or cannot do, and take up the opportunities that you think may be a good fit. And if they're not, that's fine. You can move on to the next thing. But it's hard to predict how your life or career trajectory will turn out. But as long as it's fulfilling and good for you, that's all that matters. Yeah.
And if you could choose again, if you were the Neha back then, when would you tell her that's a good plan? Go ahead, or
Yeah, I mean, I think I mean, it's not a plan, but the way it happened, I think was fine. I like to try new things, short intervals of time. So that's what's happening. So yeah, I have no regrets. I think it's only been good.
what makes an applicant stand out in pediatric radiology besides the exam scores?
Yes, their obvious stated interest, and if they've articulated that well in their personal statement and it's reflected in their letters. So it should all be consistent. And why you need to do pediatric radiology should be clear. Although I would say, I mean, sometimes people don't know why they're doing something, or that may be the only thing that's available. I personally don't consider that to be a red flag of any kind. I mean, it's sometimes you make the choices that you make the best that's available to you. But having said that, I mean, you cannot then say that was not my first choice and I cannot do it well. So you have to make a case for
Your commitment.
for being able to do it well, whether that was your that's what you always thought about or you just thought about it. But as long as you are able to, I think communication is helpful. In pediatrics, it's more important you interact with the families and the patients more than in other radiology specialties. So being a good communicator would be helpful, and that comes across in the interviews. Obviously, your application packet, if it looks like it's well thought out and well made, like you have attention to detail, that's very helpful too. Most pediatric radiologists, I think, are somehow seem to be more detail oriented.
Yeah.
So I would say, yeah, good communication skills, a thoughtful personal statement, well articulated plan for what you want to do with this, and it's vibes after all. I mean, I think after all of that. So scores, I say, are more objective, but it's I think the person can show that they will work well as a team member, communicate well, and will be hardworking, will be responsive to feedback. So it depends on a person-to-person basis. I said, like, there's no one good formula. I mean, other than the score, it's kind of hard. It depends. But if it comes through, if you have put thought into what your application is.
And Neha, do you like your career in pediatric radiology and in nuclear medicine? Can you give us a general idea of how it is for you on a daily basis?
Sure. So, I mean, in our hospital, we are over 45, 50 radiologists now. We have only 3 pediatric nuclear medicine physicians. So I would say about half of my time is probably in pediatric nuclear medicine, half in rest of radiology. And so maybe 1 or 2 days in a week that I would be doing pediatric nuclear medicine. There's academic days, so maybe 1 or 2 days of radiology. So maybe half and half. Right now I'm doing school, so it's a little bit different, but generally it's kind of half and half. And I do take calls for radiology and nuclear medicine both. So our hospital also is a bigger center, so we do have a fair bit of caseload and variety of pediatric nuclear medicine. I would say it's probably one of the biggest caseload that you have for pediatric nuclear medicine. So, so when I'm on pediatric nuclear medicine, I'm doing mostly pediatric nuclear medicine on a given day, and when I'm radiology, I'm doing like I would be could be doing fluoro, could be doing ultrasound, body, different things. But smaller centers, sometimes they don't have as much caseload in pediatric nuclear medicine. They may not even have dedicated pediatric nuclear medicine physicians. They may have like one or two people who do some nuclear medicine, and so it depends on. Our place is unique in that we are able to have nuclear medicine as like a thing of its own, but sometimes it's a little bit more mixed in with the rest of radiology. There may not be as much of a case volume. So for me, this is the ideal place to be. Like, I love pediatric nuclear medicine. That's like, of all radiology, I mean, I think I love nuclear medicine the most. And so for me, this is the perfect fit, I would say. So timing-wise, it's about half and half. What I like to do more is nuclear medicine.
Yeah, I'll have to give it a try. Everyone tells me that.
Yeah,
that is wonderful.
And peds nuclear medicine is the best kind of nuclear medicine. You have a lot of general nuclear medicine. There's a lot of like thinking that goes into it. There's also, it's kind of the end of the road test for a lot of different things, especially oncology. So you kind of have like a whole packet of rest of radiology that you can look at and correlate and connect things. So yeah, you should definitely try both peds and nuclear medicine.
Thank you, I will. Okay, Neha, let me see if there is any extra question. Otherwise, I will leave you in peace. Okay. I think the most important ones are done. So Neha, we'll just make a last question.
Yeah.
What advice would you give to someone that wants to come, but they still didn't have the courage or didn't make the final decision?
The final decision to...
No, they already, sorry, I will remake the question and I added this.
Yeah.
Neha, what advice would you give to someone that decided to come? They want to come so much, but they are still afraid of starting the process.
Got it. They are not yet done any. I mean, there's no. The only thing that you lose is time. A few years of your life, which is fine. I mean, as long as you are motivated enough, I think there's nothing to be scared of. You are where you are, and you can still be where you are a few years later. So. Obviously, it's a monetary investment, and if that's a barrier, I mean, I think there's nothing that can be done about it. Maybe you can practice a few years in your own country, make some money, and try to do the steps. But if that's not a barrier, I mean, I think you should try it. There's like 2 of the exams are going to be in your own country, so you'll have a sense of where this is going. So I don't see any reason of being afraid. I mean, all you can do is like either do better than what you're doing or come back to the same place that you are in. So I think it's a few years of your life, but it should be okay. So yeah, I don't see a reason to be afraid, and like you will forever be afraid if you're not trying. And it's not that you have to come, right? If you can be at peace with being what you're doing, that's great. If it's only when you're thinking of doing something more, then I think there's no reason to be afraid. Then just take the plunge. Most people, I would say, would succeed if they try hard enough and try long enough. And if not, it's just a few years of life. And there's learning that happens. There's like things that will happen. If other people, obviously, if you want to try to get some more advanced training, but you're not quite ready to take the steps, try Canada. I think that's where, as I said, like many of my seniors were actually doing Canadian fellowships right after residency, and then they were taking their steps during Canadian fellowships. Once they, and then they came to the U.S. to complete the pathway. So or try a different country where I think the only thing to be afraid of is like it's a financial investment. And 2 would be taking the exams. That's obviously, it's a long time it takes. So if you're afraid of that, you can try the other pathways, and then maybe you will then know better whether you want to really do it or not. And I know people who went to Canada and stayed in Canada. And
yeah, they always come. They always come to the U.S.
yeah, no, I mean some of them are like actually just in Canada as practicing radiologists, and they're doing well. So it's not the end of the world if you cannot get in, and it's a little bit easier in some ways because you don't have to take exams
The
like
steps,
this
yeah.
to start out. And obviously, if you have Canadian experience, it would be valuable for getting a position in US as well. So that's one route that you could take.
That's what Thiago did.
Oh,
But he had the test, but he went there anyway.
Anyway. Yeah, so yeah, I think that's Canada, or I'm sure there are other European countries or other places. And now I'm thinking maybe most other countries may have some advanced training too. At least back home in India, now we have more different types of advanced fellowship that you can do with radiology. So you may not need to. So it depends on what your goals, but there's no reason to be afraid. There are different ways you can do this.
Thank you so much, Neha. Neha, I can close it here, but I also want to, this I can cut off, no problem. But is there anything else that you think that would be important for you to say that I didn't ask? Because sometimes I forget what's yours. That you wish.
No, I think I talked too much.
No,
So,
if you don't think so, that's
no,
fine.
I mean, I think, yeah, no, I think we covered most of it. You're also interviewing so many people. So
at some point.
So I'm sure there'll be some overlap. But yeah, I think we covered a lot of ground.
So I will finish. Yeah. Okay. Neha, thank you so much, so much for coming here or for taking your time just to answer these questions. I'm sure many other trainees will be inspired by your story and also for your inspired with your kindness. I wish they could see how awesome you are because every fellow that comes to Boston Children's, they always say how amazing you are as an educator, even that you said that you are mostly an administrative person. They also love the amazing parties that we have in the fellowship parties in your house. And thank you. Thank you for making everyone feel so good at Boston Children's and also outside. Even that I'm not there anymore, it's such a pleasure to talk to you and listen more about your story.
Yeah, no, thank you, Jade. I'm like, I don't have words to say. I mean, yeah, I mean, I think that's too much praise for very little that I do. I'm very happy that I came here today, and if this helps even one person, that will be worth it. If not, it'll be worth it too. It was nice chatting with you, and I'd be happy to. Feel free to reach out to me if you have any more questions or in any way I can help you. And I'm looking forward to you coming next door.
Thank you so much, Neha.
Yeah, thank you.